Welcome. My name is Alexandra, and I am going to be the moderator for today's webinar. We are going to give everyone until about 3 minutes past the hour to join, and then we will get started. Hello again. For those of you who have just joined, my name is Alexandra, and I am going to be your moderator for today's webinar. We are excited to present to you our webinar, Best Practices Part 2 for the Front Desk. Our goal is to provide a valuable reminder of the importance of the front desk staff's role in your medical practice. We will also review important front desk functions and go over some helpful tips to help your practice stay successful. Before we get started, there are a few housekeeping items to go over. Questions you have for us are addressed via chat message using the Q&A button at the bottom of the screen. The questions you submit throughout the presentation will be addressed at the end of the presentation. Questions we have for you are addressed using polls. A poll will be conducted before and after the presentation. We encourage you to participate so that we can focus on areas of interest. Before introducing you to Caroline Balestra, I am going to go ahead and launch the first set of poll questions. Thank you for participating. Caroline Balestra will be the presenter today. Caroline has 8 years of experience as a practice administrator and 13 additional years focused on revenue cycle management and analysis. She currently works as a business process analyst at HealthPrime, where she coaches team members and clients on best practices, coding, and practice optimization. Without further ado, I am going to turn it over to Caroline for the presentation.
Thanks, Alexandra, and welcome everybody. Today we go into part 2 of our best practice series. Part 2 is all about the front desk and duties associated with this vital role in your practice. Not all front office staff or administrators of a practice work at the front desk, but when we talk about the tasks related to this position, they fall in this sort of category. Okay. So the topics I want to cover with y'all today are obviously not foreign to anyone in a medical practice. Sometimes talking through some of these basics can give you just simply a reminder, or it can help you find gaps that are important in streamlining of these regular day-to-day tasks that occur in any medical office type of setting. We'll talk about organization, scheduling, insurance verification, prior authorization, some tips for check-in and check-out, point of service collections, and lastly, but most importantly, patient feedback and closing that loop. Please keep in mind that every practice is unique and may have needs, softwares, or roles that are structured differently. I just hope that this is helpful for you all in some way. Let's go ahead and get started. First, I want to talk about something that's very important in anything we do in life, organization. There are many little things you can do to keep things organized and presentable, not to mention help keep you on task throughout the day. Here are some of those things. Simply keeping the reception area clean and organized goes a long way in presentation of the medical office, its staff, and overall, it helps to provide reassurance that you have the practice in order from start to finish. A clean, well-organized front desk and reception area can really go a long way towards making patients feel comfortable. Keeping things organized and tidy will optimize your workspace. For example, the front desk should have their own copy machine available within arm's reach to scan or copy insurance cards, driver's licenses, and even referral information. Some practices let receptionists lose valuable time by requiring them to walk to the back office to perform these simple tasks. Another simple idea is to use a telephone headset. This would free up the receptionist's hands to take faster notes on the computer or enter demographics while on a call to schedule appointments. The use of checklists and scripts can be developed to assist in multiple tasks to ensure that they are completed or that details are not overlooked. Checklists and scripts are a great way to help train your front desk team to deliver a high-quality customer experience consistently. The accuracy of the information that a patient receives from your office shouldn't depend on who they talk to. Front office staff should always arrive at the office well before the first scheduled appointment. This is also a great time for a morning huddle to discuss the upcoming day's appointments, open slots, potential problems, and other brief daily topics. Remember, success is where preparation meets opportunity. Pre-registration is another great way to help shorten new patient wait times for the actual appointment. Instead of asking them to come in a half hour early to fill out a mountain of paperwork, try implementing a process to capture that information ahead of time. You can either do this over the phone, online in a portal, or through paperwork that's mailed or emailed to the patient's address. Before the patient arrives at the office, you should know what type of insurance coverage the patient has, whether you are a participating provider in that plan, and if your practice provides the services that they need. All such information should be in your patient's chart and again, verified prior to their arrival. Always verify the patient's address, email address, employer, and insurance plan at the time of check-in to ensure that you have the proper information. It's much easier to do this info check when they're right there, rather than assume that you have everything and no changes or updates are needed. This can also create the perfect opportunity to obtain any additional information that you might need. Remember to ensure patients understand the financial policy that your office has. This is usually in their initial paperwork, but many will sign and not read the full detail. It's important to review some of the more important items at a high level to help create awareness of certain things such as your cancellation or no-show policy and any associated fees, or that all payments are due at the time of service. This also prepares the patient for future instances when they must give you ample notice to cancel an appointment or arrive with payment ready for you at the next visit. Effective scheduling is extremely important. Patients should be scheduled in a manner that promotes sufficient provider time for each visit, with short waiting times. Long waits, as well as limited access to care, can put a practice in jeopardy, as patients will tend to seek care elsewhere. Here are some things to think about when trying to keep the schedule on track for the day and ensure a smooth process at the check-in phase of the appointment. Reducing missed appointments can be difficult, but there are things we can do to minimize this. It's important to ensure your patients are seen by the doctor as close to their scheduled appointment time as possible. There will always be patients who are running a few minutes behind, patients who require immediate emergency attention, or other unexpected events that put the entire day's schedule behind. Although you may not be able to control how on time a patient is for their appointment, there are things staff can do to ensure the schedule stays fluid or that time lost is recouped so you can get the schedule back on track whenever possible. Confirming appointments the day before is key here, in addition to filling the schedule to begin with. If you have patients that prefer a specific time of day and request a call if they get a cancellation, or have a patient who maybe left a voicemail trying to get in to see the doctor, but you have no availability, think about keeping a list and filling those canceled appointments with these. Also, charging a cancellation fee can help to reduce no-shows and cancellations with short notice. In some cases, you can confirm appointments with text and email reminders where possible. Utilizing an appointment reminder software system will improve upon the number of on-time kept appointments. No-shows are costly and inconvenient, especially when you're a particularly busy practice and have a good-sized wait list. The average phone call to schedule a patient can take over 8 minutes. If you were to multiply that times the number of appointments made daily, that means you're spending like hours upon hours on appointment scheduling each and every day. Some practices have hired full-time staff just to schedule, but with new technology, practices are now able to cut back on unnecessary expenses with online or outsourced appointment scheduling, which allows for time spent on much more significant tasks. Online scheduling may be new to your practice, but it can offer not only lower costs, but also a greater convenience to the patient, the practice, and even the provider. Prioritize appointments. Patient visits vary in degree of time requirements and level of care needed. Consider these factors as you decide where and when to schedule your patients, or whether you even need to put them on the schedule at all. Many patient issues can be resolved with a brief phone call or email or a telemedicine type of visit. Have the staff member who fields incoming calls use their best judgment to triage each call to determine whether to schedule the patient, or have your nurse or doctor address the issue via phone consultation or telehealth. This approach ensures patients needing the highest level of care have better access to same-day appointments if necessary, and practice profitability is maximized. Having a patient recall system in place ensures that patients return for their regular care appointments, keeping your schedule consistently fuller. An automated system for recalls can also bring back patients who haven't been in to see you for their regular care appointments in years by simply sending out a reminder email, text, or a voice call, letting them know it's time to reschedule. If you don't have this, maybe putting together a project for downtime where patient recalls can be made to fill your schedule is a good idea. In booking these appointments, it's vital that you get the proper demographic information on each patient to make the next step easier for everyone involved. Okay, so let's move on to the next part of the flow, verifying that demographic information that you've just gathered. Okay, so the next step is verifying those insurance benefits and eligibility, which can include obtaining prior authorization in some situations. It's usually the front desk who not only verifies insurance prior to each visit, but who also greets and welcomes your patients on their visits. These staff members are basically the face of the practice. Recent data shows that while 79% of practices verified insurance information at the initial visit, only 25% verified coverage on subsequent or follow-up visits. Verification on subsequent visits is crucial for reducing the amount of work on the back end where billing is done. The front-end verification can therefore reduce claim issues related to eligibility and benefits, which in turn reduces the chance of those rejections and denials, also causing much faster reimbursement turnaround times for your insurance claims. Front office staff need to ask multiple questions of the payer to ensure they have all the accurate and updated patient insurance information on file. To do this, most practice management systems have the ability for you to run an eligibility check by using the built-in eligibility check function. These checks, when run, utilize a clearinghouse connection to validate the insurance information you've entered into your system. either for a single patient or sometimes for the entire schedule. Some applications do allow you to run batch eligibility checks for the entire day's appointments in bulk. These can be helpful, but sometimes, unfortunately, this is not enough detail. Many payers limit the amount of data that can be returned via a clearinghouse eligibility query. Depending on the system, the payer connection, the data they supply, or even the specialty, you may need to use other verification methods like a payer website or even by telephoning that payer for the benefit and eligibility details that you need. It's recommended that you have a standardized verification form that all staff can use for each patient, depending on the services your physicians typically offer. With these, you can ensure that the questions to be asked of the payer includes everything you need, so you can obtain all necessary information on the first attempt. It's also recommended that a copy of this form be uploaded to the patient's chart so that you have access to call reference numbers, the name of the representative you spoke with, the date and time of your call, or online check, and any other pertinent details should your billing team need them in order to support a claim. Asking for details like effective and term dates of coverage. Is the provider participating in the network? Does this plan have a deductible? How much has been met? Including what portion is the patient responsible for, if anything? And what is the out-of-pocket maximum? Has the out-of-pocket max been met? Also documenting where you are to submit claims, and are there any services that require authorization? Lastly, if auth is required, who handles it? Many times authorization is handled by a different utilization department. You know, I've experienced where eligibility and benefits for a patient was verified, and I was informed they were eligible, and the provider was a network. After submission and denial of the claim, I found that the payer had denied coverage due to ineligibility on that date of service, and ultimately, they refused to pay the provider. I appealed the claim, and because I had kept a document where I recorded the verification details of my call, they were able to see and compare this to the notes in their system, which apparently must have matched because they eventually overturned the denial and paid the physician. I have seen this happen with other denials as well, so I always recommend that you keep the details where they are accessible not only to the practice, but to the biller should they need them. If verification is done correctly for each visit, or at minimum of once per month per patient prior to a visit, I can assure you rejections and denials for insurance eligibility and benefit types of issues will decrease significantly. This is the #1 reason I see in most practices where there is always room for improvement. Many times, patients don't fully understand what insurance coverage they have. I can't even begin to tell you how many times I've asked a patient for their insurance cards so that I could make copies, and was handed both a Medicare card and an Aetna Medicare Advantage card. My patient was under the impression that they had 2 insurances and due to double coverage, had no patient responsibility due. As most of you that have had this happen know, the patient only had the MCO or managed care plan coverage and a $10 copay, not Medicare Part B. The front desk staff have a very important role in helping patients better understand their insurance plans. They should always take time to explain how they work, which order they go in, and more. Working to help patients better understand their coverage can build rapport and create raving fans out of your patients. The front desk staff are the greeters and are responsible for making patients feel welcome, and moreover, they are also in charge of not only knowing what to collect ahead of time, but collecting that payment when the patient arrives. Ultimately, without front desk staff, the office would likely be in disarray. The success or failure of each patient's claim begins and ends with your front office. Accurate patient insurance eligibility and benefit verification is the first and perhaps the most critical step in the billing process. That means your front desk staff must be on point when it comes to obtaining and correctly recording all of this information. Re-verification of benefits are equally critical. Your front office should re-verify patient insurance when appropriate. For example, if your patient gets a new job he or she will have new benefits, and that means you've got to complete a new eligibility check. But benefit details like deductibles, copays, coinsurances, and type of coverage, these can change at the beginning of the year and or month. So if you haven't seen the patient for a while, or you're now in a new month, then it's time to re-verify insurance. Consider implementing a 48 to 72-hour verification period policy for your front office. With this policy, your staff should verify and benefits and eligibility no more than 48 to 72 hours prior to an appointment. It's best to complete the verification of benefits and eligibility prior to confirming appointments to ensure that when a call is made or reminder is sent to the patient, any financial preparation can be done during that appointment reminder. By checking eligibility and benefits within a short period of time before the patient's appointment, you'll help ensure patients are clued into their financial obligation, which makes collecting payment much, much easier. Plus, it saves you from no-shows and day of cancellations due to high deductibles. If your practice works with personal injury policies or workers' compensation patients, don't forget to verify eligibility with the auto insurance or workers' compensation carrier or adjuster too. Just as you would with a regular health insurance company, verify that the patient is covered and confirm that the patient is approved for a visit with your physician. You should obtain prior authorization and provide the auto or work comp insurance company with any necessary forms before providing any kind of service. For claim submission, some will ask you to fax a claim with medical records, others want them mailed. So be sure you understand how they prefer claims are submitted so you can get them on file and paid quickly. Okay. Health insurance companies use prior authorization requirements to keep healthcare costs in check. This process ensures that the service or drug that the physician is requesting is truly medically necessary. Requiring prior authorizations will also ensure that the service isn't being duplicated. Without an authorization on file for services that require them, the insurance payer is free to refuse the payment of a patient's medical service as part of the healthcare insurance plan. Now, as we all know, there are disclaimers when you go to obtain an authorization that state, this is not a guarantee of payment. But for any service that requires authorization, if you do not obtain one, I can tell you that your claim will most definitely be denied and likely never paid. Prior authorization requirements can sometimes lead to delays or denials for care. These roadblocks cause frustration and worry for doctors, office staff, billers, and patients, while adding to the mountain of paperwork that must be done. According to the American Medical Association, 1 in 3 doctors surveyed have staff who work solely on prior authorizations. Doing that extra paperwork can cost thousands of dollars a year. In some cases, prior authorizations can be changed or revoked by an insurance carrier after a patient has received care that they thought was approved. During surgery, for example, the surgeon will do what's needed to give you the best possible results. But that could mean providing medical care that's necessary, but different from what was previously authorized. As a result, your insurer could refuse to cover you or pay the surgeon for some or all of your care. It's important that the office staff handling authorizations contacts the payer immediately when you're notified of any change to the procedure, so you can add or remove to the authorization using your medical records as justification of such changes. If this isn't done timely, then payment for any additional CPT codes or procedures will likely never be paid. Also, if a procedure, test, or visit required authorization and your practice did not obtain it as part of your responsibility, you can likely not even bill the patient because your obligation to obtain auth was not met. This can cause huge losses, and ultimately it can affect the bottom line. You may not know that authorization is required, and therefore, once again, your front desk staff is vital to the practice's revenue. These are questions that should be asked during verification of benefits and eligibility so that you know what does and does not require an authorization ahead of time. Okay, so how long does it take to get a service authorized? Well, that all depends on the nature of the request and policies of the insurer or health plan. I've seen some guidelines that promise 24-hour turnaround times for urgently needed medications or services, sometimes shorter. Where other insurers refer to like a 5 to 10 day period for a decision. So what happens if the authorization you're working on is denied? Well, I would first ensure you understand why it was denied. Reach out to the payer and ask, find out the precise reasons for the denial and how your provider needs to address this. If they require an appeal to be submitted, ask where to send the appeal to ensure it's routed correctly and no time is wasted. Most of the time, authorizations are denied for the medical necessity. The payer may recommend trying something more cost-effective first and then refiling your authorization request with that information added. If your provider feels this service is in the best interest of your patient, don't give up. Keep trying. Okay, so we've scheduled the patient, gathered and verified all information, confirmed and prepped the patient for the visit. Now we're going to welcome our patient and collect any financial responsibility for their account. Front desk staff are the first employees that the patient encounters when they come to see your physicians. They ensure your patient's initial experience is positive. All of your office staff should assist with providing a positive experience for your patients. Some of the ways that they can do this is by following these simple but important best practices. First, I think it's important to manage phone interruptions for staff who are greeting and checking in your patients. In my opinion, the number one priority of the front desk is to welcome patients as they arrive at the front office and to collect their payments. Patients should feel like they are important and they shouldn't have to wait while the front desk answers a call. The caller should also not have to be put on hold while the front desk works with the patient. By removing the distraction of answering the phone, the front desk can focus on greeting, reviewing proper paperwork, updating demographics, and scanning copies of cards, and then also collecting the payment. Having staff to answer incoming calls, billing inquiries, and scheduling calls will make a world of difference to your front desk staff. If you think about it, this is also important because private billing matters should be discussed in private and not at the front desk. When you remove the responsibility of answering the phones from your front desk staff, they can then focus on those patients as soon as they arrive. Staff should greet every patient with empathy and a smile while remaining firm about collecting expected payments. Your ideal front desk should be able to ask for money with a smile and have patients smile back as they make their payments. Confidence in collections is key for this role. What with copays and deductibles on the rise, you'll want to have someone in this role who is not afraid to talk to your patients about the money that they owe. Keep in mind that you may need to train patients during their appointment confirmation calls or automated reminders to bring their insurance cards and payments to each visit. Clear communication is also essential when it comes to the written word. So it's important to have patients sign a financial policy prior to receiving services. You should go over the intake paperwork and financial agreement with your patient at the first appointment to make sure they understand the details and so that they have a chance to ask any questions. In the future, if they question your request for payment, you can always refer them back to the policy that they signed and agreed to. Again, as we previously touched on, not everyone's comfortable asking for money. Proper wording is sometimes the key when asking for patient payments. For example, if you were to ask, would you like to pay your copay today? It sets the expectation that the patient copay is like optional. But if you were to word it as, how will you be paying your copay today? We accept X, Y, and Z. You're setting the proper expectation that copays are always due at the time of service. A front desk staff that can collect patient payments promptly will ultimately help to reduce patient outstanding debt and delinquent accounts that age out over time. There are some strategies I recommend to make this process easier on the front desk. First is be prepared. You can't ask for or collect payment if you don't know what you're asking for. Once you know you have valid, up-to-date information, You know the benefit details and if the provider they plan to see is in or out of network with the plan. And you've taken the time to verify if there's a flat rate copay or instead a deductible and coinsurance. You can then establish how much to ask for when that patient arrives. It can be beneficial if a deductible or coinsurance is due that you know the allowed amounts per code for that plan. So you can calculate the amount due at the time of service. Consider having a spreadsheet or cheat sheet available that shows what the allowable amount is per payer for the codes most used by your provider. This way you can accurately calculate the percentage amount due rather than waiting for an ERA or an EOB. Most payers allow you to collect the deductible or the coinsurance at the time of service. However, not all of them do, so it's important to know which do. Each day, it's also a good practice to look over the following day's appointments and check for any patients who have large balances due. By doing this, you can be prepared and have a plan in place for how you will handle it when they arrive. I know I keep saying it, but the better the information from the front desk, the lesser the work on rejections and denials for eligibility and benefits later in the revenue cycle. It's simply inevitable. Another tip to being successful at collecting payments at the time of service is it's important to offer as many payment options as possible. In addition to accepting cash and checks, you should always be set up to accept all major credit card and debit cards, both in person and over the phone. Some patients prefer to keep a card on file for ease of paying bills. However, if you decide to do this, you'll need to research and follow the appropriate security measures to comply with HIPAA and PCI guidelines. Please know that while storing credit card information can have its advantages, it presents a vulnerability in terms of potential security breaches that requires this decision to not be made lightly. High deductibles, which are more common now, makes it easy for patients to accumulate a significant balance in a short period of time. Payment plans can be a viable option for many. It's a good idea to collect an initial deposit as well as complete a signed agreement between the office and the patient that outlines a schedule of payment dates and amounts for any payment plan to be successful. Having this reference can help a patient stay on track rather than just letting them tell you they'll send a payment soon and then you never receive a payment. Another way to help keep a patient current is to have them pay for that day's balance and offer payment plan options for any past due balances. Lastly, for someone who says they will send a check, give them a stamped, self-addressed envelope and a printed invoice. They're more likely to remember to mail it if they walk out with this in their hand. Ultimately, asking for money can be uncomfortable, but if you're prepared and have multiple ways to collect payments and have been working to build a rapport with patients, your success rate is significantly greater. Take a moment to get to know a patient and have a friendly exchange. It can really go a long way to getting you paid. Timing is also important for collecting payments. If the payment will be based on how the visit is coded, such as with a deductible or coinsurance, mentioning it during check-in so they know it's coming and collecting it during check-out can work well. If a patient needs to delay payment until the next visit, make sure to schedule the follow-up appointment then and there, rather than waiting for them to call. Of course, they may still cancel, but if an appointment is on the calendar before they leave, you are more likely to see them again and collect your payment. Being prepared for many possible scenarios and having a plan in place for how you'll handle them is key. Coordinate any referrals or follow-up care at this time. Making a call to help a patient get into a busy specialist goes a long way with patient satisfaction. Knowing your talking points and being prepared, direct, and yet compassionate will no doubt yield positive results. For front desk staff, successfully balancing clinical and clerical demands, engaging with patients while providing good customer satisfaction is challenging to say the least. Getting feedback from patients or the back office about inaccurate insurance data, like a wrong address or phone number for the patient, can be a tip-off that problems might exist with inter-office communication. Communication between front and back office or billers is very important in ensuring that, one, the proper information is requested, and two, adjustments are made to these questions asked when needed. It's important that these two roles connect. It's recommended to meet at a minimum of monthly to review what each role is seeing throughout their day so that any need for improvement can be identified, discussed, and addressed. Wouldn't you like to know as much as possible about what's happening in your medical practice? While you can't always have eyes and ears on everything, but you can find out details about the practice by simply asking. Each patient who comes into the practice is a potential critic who can provide invaluable feedback that plays a huge role in quality improvement and professional development. Several patient feedback forms are available, such as online or system-generated patient surveys, voluntary events like comment cards or suggestion boxes, and other more informal feedback like conversation. Patient feedback is likely to be more influential if it's specific, collected through credible methods, and contains narrative information. Data obtained should be fed back in a way that facilitates reflective discussion and encourages the formulation of actionable behavior change. Like I touched on last week, there are a few ways to generate and track feedback to begin the conversations that start behavioral changes in the practice. Involvement of the entire office team, availability of different channels for feedback, and the use of quality tools are considered a good basis for using patient feedback to drive quality improvement. Once you've measured patient satisfaction to determine areas of improvement, you'll first need to know and clearly outline the mission at hand. Break it down into long-term and short-term goals. Meet with office staff to get ideas on ways to make a patient's experience more enjoyable. Always continue to seek responses and patient feedback at every opportunity. Stay ahead of the responses. Many patients and customers use social media to share their experiences. While not specific when related to healthcare, patients are likely to share their overall experiences with others online, which could affect your business. Try to stay on top of these if possible, quickly providing feedback on whatever platform is used. Offering value-based services is a great way to improve customer service. Sharing knowledge, for example, can be a great way to give your patients some value and be foremost in their mind when they might need advice or more info. Think of providing a community forum or workshop on your website to provide helpful tools for diabetes management, for example. Train staff. Well-trained representatives of your business creates a strong team. Any change you put in place or feedback you receive requires follow-up to ensure that your patients feel heard. Be sure to follow through with any change. Check in with patients and staff and get more feedback on how you're doing. If this isn't a priority for your business, you're at major risk of losing your clients to competitors who do prioritize and focus on the overall patient experience, driving customer satisfaction for the medical office. Last but certainly not least, don't forget to reward your staff for the amazing customer service they provide for your patients. After all, without them, the struggle is even more real. Okay, so I wanted to briefly talk about Prime Virtual Office services that we offer. Health Prime has some ways we can help your front office with our Prime Virtual Office add-on solutions. We can help with eligibility and benefit services where we can ensure that the information gathered during scheduling is valid and you know what to collect at check-in. We also offer scheduling and callback services that can assist with filling your calendar with new and repeat patient appointments. Sometimes you may need to obtain authorization for tests, visits, or procedures. Health Prime can also help with this time-consuming task. Additionally, as part of our Prime Virtual Office, we offer patient communications. With this solution, we can send a final notice letter to your patient on your practice's behalf, send newsletters, flyers, or any other one-page type of notice or document to a patient list of your choosing. If you're a Health Prime customer and interested in any of these solutions, feel free to reach out to your operations consultant so they can get in touch with our business development team. If you don't currently use Health Prime, that's okay too. please send an email to businessdevelopment@hpiinc.com. We would be happy to work with you to provide any assistance we can to help you streamline your front desk. Whew. Thanks for joining me for part 2 of our best practice series. In a couple weeks, we'll complete the series with best practices part 3 for the back office. I hope you'll join us. Anyways, thanks again and have a wonderful rest of your day. I'll now send you back over to Alexandra for any questions that you might have.
Thank you, Caroline. We do have a few questions. The first one is, if I obtain an authorization from the insurance carrier and the provider does a different procedure, do you know how long I have to update the CPT codes that the doctor used?
Well, each payer is different when it comes to their guidelines, but typically most give you 5 to 10 days. Of course, I always recommend you contact them as soon as you have that operative report and update the auth as soon as possible to avoid any timeline issues.
Okay, thank you. We have another question. Some doctors I have worked for double and triple book appointments. What are your thoughts on overbooking or double booking patients to fill in for possible no-shows?
So overbooking and double booking can lessen the impact of no-shows. Double booking is giving 2 patients the same time slot for an appointment. Double booking can be used effectively in certain circumstances, in my opinion, such as when a patient calls with an acute illness or injury, or when one patient can be scheduled around another patient who's maybe undergoing a procedure. This really should not be a regular occurrence, though. Rather than overbooking or double booking, a better way to handle the situation is maybe to evaluate the trend of your no-shows. What are the excuses you're hearing? When are no-shows most likely to occur? What are the demographic of the patients who maybe are typical no-shows? Do they use public transportation? Those are some things to consider. Once you have a better understanding, you can strategize on how to effectively reduce no-shows and cancellations and lessen the need to over or double book. Remember that continuously over and double booking your patients with physicians can set a culture in your practice that you may not want.
Thank you.
Sure.
Finally, we do have 2 additional poll questions for you. I'm going to place those on your screen right now. Thank you everyone for participating. And thank you, Caroline, and thank you everyone for joining us on our webinar today. For more information, you can email us at marketing@hpiinc.com or visit us at hpiinc.com. Thank you and have a nice day.